Hi, I'm Dr. Hua with Pete's Happy Hearts. This channel talks about different heart topics. If you haven't already, please take a look at the hidden danger of a normal sports physical screening that talks about sudden cardiac death in athletes. Link is above. Today, I would like to talk about one of the common causes of sudden cardiac death in athletes. It is called long QT syndrome. So what is long QT? So long QT is a type of conduction disorder. A conduction disorder is a problem with the electrical system that controls your heartbeat. A long QT interval can upset the careful timing of the heartbeat and cause sudden, uncontrollable, fast heart rhythm. So when they do occur, they can be fatal. What causes long QT syndrome? Long QT is often inherited, meaning you're born with it, and you have it your whole life. Either you know it or you don't. So if there's a family member with it, then it's more likely it's inheritable. You can also acquire long QT syndrome, meaning you were not born with it, but then you developed during your lifetime. A family history of long QT should prompt you to have genetic testing or other things. If you have heart conditions such as cardiomyopathy or congenital heart defect, you might be a higher risk as well. Medical conditions such as thyroid disorder, eating disorders that disrupt your electrolytes can lead to this. Medication that affects how your ion channel works, that affects your electrolytes, can lead to the long QT syndrome. Most of the time, it's either antibiotics, antidepressants, or antihistamines. Most of the time, these medications are transient, meaning when you stop the medication, the long QT should go away. However, if you're taking medication that prolongs your QT when you already have an underlying long QT syndrome, then that puts you at higher risk and makes it worse. So what are these symptoms? Some of the symptoms could be fainting, drowning, seizures. Some people may never have any symptoms at all, and they can be called silent long QT syndrome. In about 1 out of 10 people who have long QT syndrome, cardiac arrest or sudden death is the first sign of long QT syndrome. So how is it diagnosed? If someone in your family has long QT syndrome, your doctor most likely had order heart testing or genetic testing to screen you for this condition. An EKG or ECG is the most common test to diagnose long QT syndrome. An EKG is a test that detects and records your heart's electrical activity. Information from this EKG is mapped on a graph, so your doctor can study your heart electrical activity. Because your QT interval may change from time to time, you may need to have several EKGs over a period of times or weeks. A heart monitor even may be essential. You may also need a stress test where you run on a treadmill and your heart rate and rhythm is also being captured at the same time to see if there's any changes in your QT while your heart is working hard and beating really fast. So how is it treated and how is it managed? The goal of treating long QT syndrome is to prevent arrhythmias or these abnormal heart rate and rhythm and preventing any fainting spells or sudden cardiac death. Treatment isn't a cure for the disorder and may not restore a normal QT interval. However, treatment greatly reduces the risk of life-threatening arrhythmias or heart rhythm. So there could be lifestyle changes, certain activities, certain things that lead to higher motion, lead to higher heart rate, things like that needs to be adjusted. Medications. So either preventing medications that can prolong QT and also medication to slow down your heart rate. Most common medication is called beta blocker, where it slows down your heart rate in response to physical activities and emotion. So this picture shows patients of different ages who takes medication that decrease their heart rate and their long QT interval, which will decrease their risk of going into abnormal heart rhythm and decrease their risk of sudden death. Now, in certain people with higher risk, medical devices such as a pacemaker or defibrillator may be implanted to help control the heart rhythm. So in summary, most competitive athletes are asymptomatic, so getting screened with ECG and echocardiogram or heart ultrasound is essential. If you have access to an ECG, I think adding it to a sport physical is important, as it is 6 times more likely to detect a heart condition associated with sudden cardiac death. So if you have any comment or suggestion, please leave them below. I always like to say, play hard, but play safe. I look forward to seeing you guys at the next video. This video is informational only and it's my opinion. It is not medical advice.